Can I just ask, the communications campaign you hired M&C Saatchi, yes?
For the advertising, yes.
Yes. Who's advising your leaflets?
So that is being done by the communications team at Shaping a Healthy Future.
Okay. Have you read 1984 by George Orwell? Pardon?
Not.
Okay. In that case, if you heard, you may feel a little embarrassed about using the word, instead of using the word closing for Hammersmith A&E, you're using, what is it, changing? Okay. It's very much from that book, hence the laughter in the audience. Do you feel, given that you said, and I quote directly from what you said, people don't understand the difference between an A&E and an urgent care clinic? And then Dr Spencer said, if someone's, in the example that Patrick McVeigh put forward, said well, he would recommend always go to an accident and emergency department. You put those two statements together, people don't understand an accident and emergency department to an urgent care clinic, is what you say. He says go to an accident and emergency department. You see where I'm going with this. There's a potential for an awful lot of confusion. Does it leave you feeling concerned about putting lives at risk, given that in some cases it is children with meningitis, as Councillor Colfax said, or it is people with heart attacks, or it is who are self-diagnosing and getting someone to drive them to the urgent care clinic, or it is people with other serious conditions that may be put at risk because they're turning up at an urgent care clinic instead of an A&E. Does that make you nervous as a professional communicator?
This is the reason why we've done independent testing, to make sure that what we're doing is understood in the correct way by members of the public.
Right. What is the percentage of people admitted to A&E who you think will be treated in the community from the Charing Cross and Hammersmith closures? There's some wording in there, closures.
I'm trying to work out what the denominator would be and what the metric would be. I haven't got an easy way of giving you an answer to that.
Does any... Okay, well that's fair enough. You have a lot of people here. Does anyone know? Dr Spencer, do you have any idea? Or Dr Batten? Who's on top of this brief?
I don't have the number with me. I can certainly provide it. The work was done as part of the NBC. We were working out the bed capacity was needed.
Okay, can anyone bail 2 GPs out there last? Dr Batten, are you aware of this figure? No? Okay. But can I just come back to the point, of course, with some concern, which is Dr Spencer's comments about going to an urgent, to an accident emergency department. You're a professional doctor. Does it not cause you any concern when you hear the communications expert you're working with that people don't understand the difference between an A&E and an urgent care clinic? And given the government's reclassification of A&Es as classified class 1, class 2 and class 3, class 3 being pretty much an urgent care clinic, which is hence the discrepancies on the NHS England's websites, do you have any nervousness as a professional doctor that people will be going to the wrong service, given that they do not fully understand the difference between the A&E and they will get expert care suited to their needs, and an urgent care clinic, or even a class 3 A&E, which for all those purposes, as you say, an urgent care clinic? There must be some professional unease at that misunderstanding of the potential effect on risk of life.
I have no concerns around that. Where urgent care centres are in place elsewhere in the country, we haven't seen the tragedies you describe. It's certainly possible that somebody could go to the wrong place, as they currently do. Our A&Es aren't uniform, don't provide a uniform range of services. But we have clear protocols that enable them to be transferred to the right place, and that's what makes it safe.
So Dr Spencer said absolutely no concerns, which is a bit too definitive for me. I don't think that's possibly cited. It must be some. Everyone who's medical has got doctor in front of their name. Would you care to comment? You have no concerns either? Absolutely no concerns, and I remind you you're on record.
Yeah, I don't have any concerns.
When you see the communication campaign there, you must realise there's quite a lot of space in misunderstanding. That doesn't concern you in the slightest. You've seen the communications stuff. You're a deputy chair of this CCG. No concerns about that and its effectiveness and the space of misunderstanding.
When we first discussed the communications programme amongst the CCG board, most of the clinical members were in favour of a message which said specifically closure. Now, we've taken expert advice on this,
From M&C Saatchi.
who I believe are experts in the field of public relations and communications.
It depends what the brief is. I mean, if the brief is let's get through this without any problems. The brief is let's get through this without any problems. And yes, you might want to sort of 1984 language. But if it's actually how do we get very clear messages about what the changes are and how do we reach all those people and how do we set targets for those numbers of people, well, we've already heard the answers on that. That's not the advice that's been given so far.
When you don't have expertise in a field yourself, I'm a GP, I'm concerned about what happens to my patients day to day. I still spend most of my time in the surgery seeing patients. So, am I concerned that they understand what's going on? Of course I am. Do I feel that the advice we've been given is the right advice? It's advice from an expert company. I'm not an expert in communications. So therefore, I take the advice from the expert panel. I'm led to believe that the procedure for choosing a company, this was procured in the same way that other services are on the NHS procurement website, and this was an open and equal playing field for anybody who wants to.
Because I believe, someone who understands communication, that this communication is putting lives at risk. Dr. Spicer, just a yes or no, are you completely content with the communications campaign that's gone out? You've seen the brief. You do not believe in any way that it's in any way likely to infringe health outcomes in this borough?
The issue is that we've seen bits of the communication plan, and some of those elements that we've seen are to say that there is a change taking place. There are other elements of the plan that give more detail. So I think we're in danger of judging something on a small sample of the information that's going to the public. I think there is a confusion about what the independent view is. As a clinician, I prefer the closing message. I think most of my colleagues did, but we had to weigh up the fact that the feedback that we were getting, not from Saatchi, but from patients groups, actually gave us a different steer when you don't know about, when you're not in the know about things like A&Es and urgent care centres, then the preferred vocabulary from residents was different than we would have chosen.
Okay.
So we had the dilemma of which to choose, and we went with what patients wanted from the common strategy.
Alright, I think you need to look at this again. As you say, you're a doctor, you're not a communications professional, but I'm telling you that your communication is not doing the job you want it to do, and people will be coming to Hammersmith A&E thinking that's what it is, and that statistically will have put some lives at risk, and you owe it to us in your position of authority to look at that, to completely understand it. It's not as difficult as learning medicine, and to come back and give us a recommendation of what you think. Now we can get the answers there, and I guess we're going to see a pattern here, but Dr. Batten, you're perfectly happy with this, I mean, seeing this communication.
I'm quite concerned about our current A&E department at Hammersmith. So I think what is being missed a little in this discussion is the clinical imperative to make changes at our current Hammersmith A&E department. We have a service there that is currently not staffed by A&E physicians, and we have a middle level rota that we know has vacancies in it and that we're filling by locums. So we have a clinical imperative to make change at Hammersmith A&E. What we are trying to achieve is that change in a planned, sustainable way, and not having an unplanned failure within that A&E department. So when you ask your question, you're obviously asking it in a very targeted fashion. We have taken independent expertise and advice about the best way to communicate with the public. Our interests are ensuring that the community absolutely understands these changes.
I'm seeing a pattern here, but none of the answers have been given to me to persuade me that this communication is professionally targeted, letting people know the discrepancy between what your communications expert said and what Dr. Spencer said. And that's another matter. That's where lives are put at risk. And unless you properly assessed it, then all of you would be culpable at doing that. So I'm asking you to review the communications programme, to share the objectives that you've given to M&C Saatchi, to make that public, and then let us, as the democratically elected committee, assess whether you've you get it wrong, it's not your pride that will suffer, it will be people's health, sometimes fatally. And that's what you haven't convinced me